Facebook's having issues today, so we're just going to record it and then post it later.
Okay, well, there's no time like the present. So let me welcome everyone who's joining our Task Force Town Hall and wish you a good afternoon. We're grateful that you'd spend some time with us, especially grateful to Governor Herbert. And we also have joining us on our town hall today, Senator Stuart Adams, who's president of the Utah State Senate. We'll have Kris, who's running the implementation of the Utah Leads Together plan, who will be here to give us an update. We also have Jacey, who's the General Counsel and Vice President of Public Policy for the Salt Lake Chamber, as well as Vicki Varela, who's the Executive Director of the Utah Office of Travel and Tourism. And Vicki's going to, I assume, Vicki, you're going to show us some of the things that we were previewed yesterday, which are just some tremendous ways that we'll be promoting the state and continuing an important part of our economic recovery. But before we get to any of that, let's start, as we always do, with Governor of the great state of Utah. Governor Herbert, go ahead.
Well, thank you, Derek. It is a great state because we have a lot of great people that live here. And the people we have joining with us today are part of that great group of people, men and women, that are making positive things happen in a very difficult and uncertain time. I'll just welcome everybody and thank you for what you're doing for the business community and the chamber and the impact it has not only here in the Salt Lake Valley, but really statewide. So thanks for all you're doing. Let me just be very brief and say there's a lot of good news out there. Doesn't mean we're out of the woods, doesn't mean we're still not in a state of emergency, but we have a lot of good data and good news and reason to be very optimistic. Certainly to appreciate that the plan that's been put in place by so many people, Utah Leads Together, and we're at 2.0, soon to get to 3.0 in the future here, is really in fact working as we implement it. And we've been pretty steadfast about making sure that we don't deviate. We've not let political pressure and critics and others out there that are taking pot shots deviate us from where we're at. We've let the data and the science direct us. And consequently, we have a good plan that's working. And I'll just give you some reasons why, or some examples of where it's working. Our infection rate has gone down from what it was in the beginning. We're now down to 4.2% of those being tested. And that seems to be going down little by little. So that's a movement in the right direction. Our fatality rate is about 1%, which even one fatality is one too many. We certainly understand that. But compared to the national average, which is 6 times higher than Utah, we have a pretty good number there. Clearly, it's this issue, we ought to talk about the vulnerability and those who are at high risk, those over 65 years of age. And even more, I think, concerning is the underlying issues of respiratory problems, heart disease, obesity, diabetic. Those things tend to be more likely to cause you to pass away from this COVID-19 virus than anything else. And so we need to be very sensitive about those that are elderly and have these underlying conditions. Like 70% of all those who've passed away fit in that category. The international average, by the way, is 7 times higher than what Utah's fatality rate. Our transmission rate has gone, we're down to about 1 to 1, which means one person's infected, they infect someone else. We know that the majority of those come from households as we're tracking and tracing, and we have a high number of being able to identify where that's coming from. That again gives us information to help us, in fact, strategically find ways to slow or stop the spread and to treat those who are infected and isolate those who have the coronavirus. So it's good to see our transmission rate is down. We are doing a lot more testing. Our capabilities for testing is up. My concern is we're not testing as many people as we're capable of. We're able to do about 9,000 a month. We have ARUP that's come on board. I went on a tour of their facility here last week. They're able to do 90,000 a day in their lab. And these are blood tests and again, an opportunity for us to in fact test in a different way to see if anybody has had the virus and maybe did not know it, to see what the spread is throughout the community, and maybe have a better number to know exactly how infectious it's been. That'll again help us as we prepare for the future. Our hospital utilization is good in that we've worked very hard to make sure that we did not overwhelm the healthcare system, which is what we saw in other countries and other states where we have really high incidence and large fatalities and more severity of the coronavirus. It's because they've overwhelmed the healthcare system, which was not available to help people. And so the good news is in Utah, right now we are using about 10% of our ICU beds. So we have a significant number of beds, those that are available for use, 2,238 non-ICU beds, and a total of non-ICU beds overall in our state hospital systems is now 4,151. Right now, we're using 99 of those. That's why we've opened up elective surgery now. We have a significant opportunity to expand our utilization of our hospitals, our dentist offices. I had a conference call for 2 hours this morning with our healthcare providers today, and they've been wonderful in helping us get to where we're at, and now need to open up their opportunities economically for their own needs, as well as servicing the people of Utah. We had 18 new admissions today, which brings our total up to 99 of hospitals. So we have plenty of headroom, and again, indicative that our infection rates are going down, and those who are needing hospital services are not growing, but in fact declining. So overall, the good news is that our state's moving in the right direction, the correct direction. We've gone from red to orange. I think there's opportunity for some parts of the state very shortly to move to yellow. That gives me hope and optimism. I think that's in fact going to happen. I would remind everybody listening that success is really dependent upon how we conduct ourselves as individuals. We look for government to fix problems or somebody in the private sector to come up with a cure, and all those things are important, but there's nothing more important than individuals
after 5.
taking care of ourselves as we see a need to do that. And that means isolate yourselves if you're sick. Please don't go to work if you're sick. That means making sure we follow the protocol of wearing a mask, some kind of face covering. It's disappointing that we hear people out there marching in the streets around the country and talking about their civil and constitutional rights without having any regard for their neighbor. And frankly, wearing a covering not only protects yourself from anything that would be in the air or somebody sneezing or coughing, which those droplets hang in the air for a period of time, but it also stops you from coughing or sneezing and spreading droplets in the air or on surfaces where you might be asymptomatic, but still the ability for you to cause other people to get sick. So the more we have people wearing coverings, the healthier we're going to be, and the sooner we'll be able to get this not only out of the orange state, but into the yellow state, and then on to recovery. The irony for some of these people who are marching and saying, we need to open it up to now. We want it now, today, and I'm going to prove my independence by not wearing a covering, actually slows down the ability for us to open up the economy. That's the irony of some of these people and some of the foolishness that they're speaking. So again, let's all be willing to comply with the guidelines that we have, and that includes employers making a safe environment for employees, employees doing what they can to make it safe for the customers coming in, making sure that they do what's necessary to make it a safe environment for everybody. If we'll do that, we're going to move to yellow, and sooner than you think, we're going to move to green and be into recovery, hopefully by sometime this summer, and then have a really healthy last third of the year as we start to recover and grow the economy once again. And I believe that can happen. It's up to us to make it happen, and I hope that we will. So thank you, Derek, and thanks to everybody for all you do for the business world and the business community of Utah.
Thank you, Governor. Thanks for that information, very important and timely information, and thanks for the message as well. Let me ask you, if it's okay, 3 questions that I hear very frequently, and I think it'd be of interest to our business leaders who are participating in this town hall to understand the thinking of the governor on these 3 questions. Probably the most commonly asked question that I hear is, why are we talking about reopening businesses, quote unquote, reactivating the economy, if we're still seeing the spread of the virus, if we're still seeing new cases every day? And I'd love to give you the opportunity to address that, because I think there's a lot of misunderstanding out there on that point.
Well, we have a plan, and again, this is not just something we pulled out of the sky. That's actually been the best minds, our best scientists, our best medical advisors, our data people, the work of Kristen Cox and Natalie Gochner and many others, you, Derek, has helped us to have a plan that gives us a direction, a pathway to follow. And we're never going to get risk down to zero. We have people that keep thinking, well, I'll go out when there is no opportunity, no chance of me ever getting the COVID-19. That's not only not going to happen, it's probably irrational to think that it could happen. But what we can do is manage the risk. As I mentioned, we're down now to about 1-to-1. That means we have 1,000 people that have it, 1,000 more people will get it, and it kind of stabilizes and stays the same. We would like to get it so we have 1 to less than 1. That means the numbers will start to shrink. That's in the future, and I think that's doable, by the way. But nevertheless, it's a matter of managing risk, which is what we're trying to do and which we are doing. The fact that we have, it's not just transfer rates, it's not just infection rates, it's capacity of the healthcare system itself. That's a major issue. It's also balancing the need to have an economic growth. We cannot continue to survive. In fact, you'll find historically the wealthiest countries in the world happen to also be the healthiest countries in the world. So there's a correlation between health and wealth. And so we've got to make sure that we don't have such a precipitous fall in our economy that it also, in another way, starts to impact people's health. And that happens. If you can't pay your bills and if you can't afford your health care coverage, that it's a significant problem. So again, taking all those things into consideration, we understand this is a balancing act between the health of individuals and the health of the economy. We talk about the health and the livelihood, lives and livelihood balanced together. And I think, frankly, Utah is doing it as well, if not better than any state in America. And so consequently, we can dial the knob a little bit more. It's opened up the flow of economic opportunity. It's not an on-off switch. It is a dial, and we're doing this incrementally, methodically, as the data allows us to do it.
I appreciate you sharing that clarification, Governor. And I want to also ask you another question, opportunity to provide some additional clarification on the topic of masks, because you raised this and it's a very important topic. The question that I often hear from people, and we'd love to get your thoughts on this, is should I be wearing a mask all the time when I go outside, or only when I'm not able to social distance, only when I'm in groups or closer to people? You know, imagine going to the grocery store. It's hard to stay 6 feet away from people. That's a time that we obviously ought to be wearing masks. But what if we're just by ourselves wandering through the foothills? Or what if we're walking through a park? Is the answer that we should always be wearing masks, or only when we're not able to social distance?
Well, wearing masks really is a function of risk. I know you like to mountain bike and hike up in the hills, and if you're the only one on the trail, chances are you're not going to inhale or breathe in or get anything in your eyes or mouth that has some of the virus in it. Now, the more you are with people, the more that risk goes up. So, you know, that's a kind of a common sense individual responsibility issue I'm talking about. The government can't give you the rules and regulations on every situation. But here's some guidelines. One, if you're alone, you don't need to wear a mask. If you are outdoors, I think that's a good place to be, where you have a lot of fresh air and air movement. It probably is less risky than being indoors. If you're indoors and you have people, you probably ought to be wearing a mask. And even if you have social distancing, I know there have been tests now that we've conducted across the country, and dine-in restaurants where people inside the restaurant, based on where the air circulated, would get sick when somebody was in the restaurant that had COVID-19. And they were farther away than were the people sitting in maybe the adjacent table. So again, enclosed where you breathe the same air in a smaller confinement, probably ought to be wearing a mask. If you're alone, not so much. If you're outdoors, again, I think the risk goes down unless you are in an area where, sometimes our athletics, rather than just a common breathe in and out, you're huffing and a puffing. If you're running, if you're playing tennis, you might want to stand not as close to somebody that's been breathing heavy, because they have more likelihood of expelling to you the virus or you breathing in the virus. So again, it's various gradations. Again, most of this is just kind of common sense, intuitive to all of us. Analyze the risk and decide whether you should be wearing a mask. It doesn't hurt to wear a mask, by the way, anytime.
Again, Governor, great information. You mentioned mountain biking. I was out at 6 a.m. this morning on the Bonneville Shoreline Trail. I confess there was a lot of huffing and puffing going on, but I was alone, so I did feel safe. We're grateful, Governor, that you take time out of a very busy schedule to be with us, and we now want to turn some time over to Kris Cox, who's the Executive Director of the Governor's Office of Management and Budget. Kris and her team are really responsible for the implementation of the Utah Leads Together plan, and so we've asked her to join us and provide some updates on the data that they're seeing, on how implementation is currently going, and what the next 1 to 2 weeks looks like, her projections and predictions. Thanks, Kris, for joining us.
Your team's, oh, there we go.
There you go.
Thanks so much for having me. And the governor just summed it up perfectly. I don't know if I need to say much. We really do. Let me talk a little bit about what's happening, next steps, and then the data. The first phase was an urgent phase in the plan, and it was urgent. It was fast and furious. We really had to build. I'm sorry, I'm outside. I had to kind of walk home, and I didn't get to my house in time. For those of you on the phone, I'm blind, so driving's always a challenge. So we stood up a lot, and now we're in this mode of, we call operationalizing it. I always talk strategy points you in the direction, but execution gets you there. And execution's tough. Our first phase was to get the high-level measures such as hospital capacity, ICU utilization, transmission rate, point of origin data, testing capacity. That was just phase one, and in fact, we're ahead of most states just on that. We're now looking at operational data. For example, cycle time from when somebody gets tested to when the first contact is made if they're positive. We started implementing that about 2 weeks ago, and we've already in 2 weeks seen an improvement. I do feel like we still need to speed up some of our cycle time issues in that space, but we're really into the operational data. Again, we talked a lot about testing, right? Because we knew testing would be a way we could open up the economy and protect public health, because we could identify people who are positive, quarantine, et cetera. But now we're moving into a plan to test asymptomatic individuals, high-risk populations, people who work in long-term care facilities, our prison where we've had 0 outbreaks. Other states have had to actually do early releases. So that plan, and we'll be tracking how many are in each area, and are we really managing that. This team has been really helpful in helping us identify critical infrastructure, et cetera. So that's a big deal right now. And then this at-risk population, we've heard a lot about that. The governor spoke about it. Another rule of operations for me is the concept of triaging and looking at, is somebody who's 30 with asthma at the same risk of somebody who's 80, prior hospitalizations with 2 underlying conditions? We're looking at the people who've been hospitalized and the people who have unfortunately passed, which is over 60. About half of those came from long-term care facilities. So we have some areas we're going to be shoring up in that space and really understanding what are the common characteristics of that group. We know minority populations tend to struggle with this and get higher infections than others. And so we're also working in those communities to push out testing, translation, making sure they have people they can trust to go to. So a lot going on in that space. A few more points on that risk, then I'll give you some data points. Again, there's the kind of high risk. We grouped the at risk into different groups. One is the group I just talked about, the super, super high risk. Who are they? The other group are people who are at risk but still need to work. We've sent out information to employers, to our Department of Labor and UI, working with Eric and his team, to really give guidance to employers. How do you help people who are at risk in your place of employment who still need to work? We have people who are under state care, our prisons, oversight, long-term care facilities, developmental disability centers, et cetera. And then we have a group of people who are older, have natural supports. We're not as worried. My mom is, I can go see her and talk to her every day. We're worried about people who are older and don't have natural supports built in. And we have stood up this week a pretty big statewide effort to do outreach as we build that up. We're working with our AAAs, Aging and Adult Services. We have 12 of them across the state. They had some CARES money. We have infrastructure. And as the need arises, we're serving about 20,000 people right now. It could go as high as 40 to 70. We can ramp that up, bring volunteers in if we need it. So we're trying to be very aggressive on the at-risk front as we move from red to orange, orange to yellow. Governor talked about a lot of the data points. And Derek, you asked a good question. Is more cases every day a bad thing? And the reality is, since we've gone to orange, we've really averaged about 150 new cases a day. So we've stayed really steady as people have become out more, more places of employment are, normalizing. So that's a really good sign for us as well. Governor talked about the positivity rate, which is good, and we're going to be watching that at-risk population pretty carefully, and our transmission rate staying within good boundaries. And so we'll be doing a pretty big statewide analysis in the next couple of days to see what it looks like for different parts of the state going to potentially yellow, and bringing that information to Derek and the governor and folks to review. The governor said this is about managing risk. This is never going to be zero risk. I mean, we have 50, 60,000 people a year who die from the flu in this country. In Utah, it's 340, 380. So we don't live in a zero risk world. It's about managing a risk that is tolerable and doing our best at risk populations. We are also looking at how do we open up school in the fall. We have a plan working with all of our presidents across our institutions of higher education. They'll be bringing forward more detail on that in the weeks ahead, probably in the next few days. And then we'll start doing some work with our K through 12. And the final point, Derek, is we did start what's called our large-scale field testing. And we have two types of testing. One is clinical individual diagnosis. Do I, Kris, carry it? But we're also trying to diagnose the health of our community. Prevalence, initial estimates talked about for every one person who had it, 4 people out there had it, and we just didn't know about them. They were unknown to the system. It could be that there's more people out there that have it. If that's the case, the fatality rate could actually be less. We don't know. So we're going out to do some randomized testing, working with the University of Utah and some folks from the University of Chicago to do this statewide, and we'll start getting information about each week as they kind of roam through. They'll do the kind of populated counties, and then we're going to have them do rural counties and our schools, a program to work with our schools to really understand our student population so we can prepare going back to school in the fall. And I feel optimistic. Our employment numbers are not easy, but I feel very optimistic about the rebound, reactivation, as Derek puts it. We're a better place than most states, but we are not an island. You probably heard that even with our bonding that we just had to put out last week, we're AAA bond rated still, and that's pretty amazing. But we know it's still hard for employers out there and employees. So we're trying to go as fast as we can to get this economy going because, we see the challenges on that side as well. 3,000 jobs lost a day in the urgent phase. I mean, that's tough. So we've got to get back to normal as fast as we can, and we feel like this plan is working. It's day-to-day management. Nothing's perfect. We're working through issues every day, but we feel like we're in a good direction.
Thank you, Kris, for that update. And you concluded by saying it's day-to-day management. I would add that in Kris's case, it's also night-to-night management. I mentioned on our last task force meeting that I don't know when Kris is sleeping because I talk to her a few times every day, often at the end of the day, and then I wake up in the morning and I've already got 5 emails from her. So got a lot going on. Because there's a lot of questions I I want to ask you, we only have a couple minutes. I wanted to talk about schools in the fall, but I'm actually going to hold off on that because I think we could probably do an entire town hall just on education
Yep.
and what's happening now as well as what we're planning for the fall. But let me ask you this question in the minute we have left, and that's the term hotspot. So we're seeing that in the media, and we hear, you know, there's a hotspot at this city, or there's a hotspot in this county. Tell us what that means, and maybe even more importantly, how do we deal with it?
Yeah, okay, that's great. Like, for example, Cache County, you know, people said hotspot meatpacking plant. The reality is when they got into it, it wasn't that big of an outbreak. It was known. They knew that it was mostly family members. So the press can kind of hear it and then push it out. And then when you get into it, it's actually not so bad. So hotspot is where you're going to have, an outbreak, but it could be a very small outbreak. It could be, in this case, 7 to 8 people. I think it was 8. So we will have those. We are not going to be in this position where we don't have anyone getting it. It's asking like nobody gets the flu. That's just not going to happen. What we are doing, and Jeff Burton, who's over health, is just awesome. We're deploying a bunch of small mobile teams, National Guard, that we can really go blitz and do pool testing when we see those hot spots, so we can really shut it down quickly, test everyone around them, the facility, see what else is going on, and just shut it down, quarantine where we need it. And that's maturing as we go. His teams will add a lot of force in this area. So, you'll hear it. Don't be too concerned. I'm not saying don't ignore it, but it's going to happen. And I hope as we get on, I didn't know this until somebody told me last night that CNN has a ticker that talks every night about, the death toll. And, I think there's some advantage being blind because I just don't see all of that. And I'm just looking at the data that's just in front of me, the real data. And this is a difficult time, but hot spots are going to happen. And just part of life. I'm not overly concerned. We've got teams and infrastructure set up to go deal with those.
Thanks for that clarification, Kris. And thanks again for joining us and for all your leadership. We want to turn now to another important leader in our state on this effort, and that's President Stuart Adams, who's helping to lead a legislative commission. We've asked him to give us an update on what's happening with that commission, and probably President Adams, it'd be helpful for our group here to understand the purpose of the commission and the work that it's doing.
Great, appreciate that. Appreciate being with you, and Governor and Kris, what great leaders, and yourself and others. You're on the commission, but this is not done alone, and so many people are involved, and we're seeing that happen with the commission. The commission was put in place to do probably 2 things, and one is, and there's been a lot of work done on maintaining the health and actually focusing on the virus and making sure that we're looking at those numbers that the governor and Kris Cox has talked about. But the other portion is to actually try to do both, is look at the economy too. Because quality of life isn't just your health, but it's actually your economic capacity and ability to enjoy life. And so, and that's a real difficult task. And I think we all feel that burden as we try to maintain the people's health and make sure that this virus doesn't get out of control. But on the other hand, we have to make sure our economy stays at least somewhat vibrant and it stays intact, and actually we recover economically also. So it's a dual prong approach, and I think the commission has looked at both those issues. And so as we've done that, we've actually commissioned other task forces underneath us, and we've actually have a task force looking at that vulnerable population and a medical task force trying to get the data. And in order for us to have the ability to have a trigger points and to be able to move, as the governor's talked about, from red to orange to yellow, we have to have the right trigger markers to be able to do that. And so we've actually, and Kris has been so good at getting that data. I might just divert for a minute, and I like to go to different websites, and I go to Worldometer, and you can see that if you've ever, any of you have been on it, but you see Utah compared to other states. And by the way, as I pull it up, right on that website, our deaths today are 73. We have 6,432 that are infected. The District of Columbia has 6,485, almost the same number. Their deaths are 336. Nevada's a little below us at 6,311 infected. Their deaths are 312. Again, ours are at 73. If you go over and look at the other tables, our tests per million are 47,000, one of the top in the nation. But as we look at that data, and then if you go further, it'll give you actually the Washington State graph, and maybe some of you remember that graph, or what we call the projections. And the original graphs looked kind of like the Washington Monument. They started off kind of flat, then they popped up high as the Washington Monument does, and then down the other side, almost straight up and straight down. Well, if you go to those same models, those models right now look like speed bumps. They don't even exist. We don't show any projections of that Washington Monument type of increases. And a lot of that's been because of, again, Kris and others, we're not focusing on models, we're focusing on data and those trigger points and the data. So we've asked for more data, and maybe I'll share some of the data we're getting, but we're trying to get more, the information on fatalities and those that are hospitalized. So on May 4th, and this is a little bit old data, the average fatality age was 72.5. That was the average age of the fatalities. As of May 4th, 70% of the deaths were 65 years or older. 76% of the deaths they had an underlying condition, and we talked about those of a heart condition, asthma, diabetes, lung, kidney, liver, some type of, and so, but when you combine those two together, the 70 and 76, and this is a little later data on May 7th, 93.4% of the fatalities had either one of the other. So 93.4% either were at high risk population, meaning they had diabetes or some other challenge, or they were over 65. And today we looked at the 5 fatalities we had. 4 of the 5 were in rest home facilities. All of them were 65 years and older. 3 of the 5 were 85 years of older. And I think if we look at that data, it helps us be able to make decisions. So the commission is focused on trying to get that information so that we can make those moves from red to orange to yellow and to green, and make sure we evaluate those trigger points. As we look at the great effort, and Natalie Gochner has been so good at putting together those metrics, and each of those the guidelines for each of the industries within those red, orange, yellow, and green. We've also looked at that as a very dynamic approach. We knew that as we implemented this, that there'd be different businesses that have different dynamics or different protocols that they need to deal with. For example, Vasa is quite a bit different of a healthcare exercise facility than Orange Theory. And as we try to refine the information inside of those, the orange or red, this commission's looking at those, trying to make recommendations to the governor's changes that may happen. And the biggest issue that we're looking at, and as we've analyzed and looked at all the data that we can bring in, is that at-risk population. I know that Kris has talked about it, the governor has too. But we're a little bit concerned that as we talk about red, orange, and yellow, somehow in the mix of all this, that at-risk population is still at red. And that message we're trying to maybe emphasize and articulate is that even though we're making strides and we're doing very, very well, but if you look at the data that we're looking at, we need to make sure that population stays at red. And if you're an employer, I may give you an example. I've got a daughter who works, but she's taken on a Down syndrome boy who's her brother to her husband, whose parents are no longer living. So they take care of this Down syndrome boy at home. If she goes to work, even though she's healthy and strong and probably may get COVID, she'll be fine. But if she brings that home to that Down syndrome boy, he won't do fine. And so we need to be careful of those as an employer, those employees we have that have that at-risk population, not only the workforce, but those employees that surround them. So as Kris indicated, we're doing a lot of work trying to find a way to make sure that we focus on that at-risk group. And again, we have a different task force actually looking at that. We have one, a medical task force trying to get that data, both the fatality data, and we're trying to get the data of those that are in hospitals, and then we're going to move and try to get information on the 6,000 or 7,000 of those that have been infected. And then another issue that we've all been focused on, but we're giving a lot of effort toward, is actually antibody testing, finding out what the herd immunity is in Utah. And if we get that information, we can actually then make additional decisions as far as, again, trigger point decisions as to how we open up and how we are able to move the economy forward. But I'm confident that we can do both. I'm very confident, as many are here, that we can protect us from the virus from spreading, especially to those that have the highest probability of fatalities. And I think we can also keep our economy going. And we're moving to the next phases of probably trying to look to see what the effects are, and trying to find a way to reduce the what I would say the challenges that come from stay at home, staying safe, and some of the social issues, suicide rates, and some of the other things that come with businesses. So we're focusing on that too. Been a lot of work done. Teresa Foxley has come up and done a lot of work, and Kris has too, in buying PPE. We've disseminated that. I think there's over 3,000 businesses that have received masks or actually asked for them through our application process, and getting the protective equipment out to businesses. I look at this, and if many people think, well, you can focus on maybe the at-risk population like Sweden has done, but I don't think that's the option. I think you have to focus on the at-risk population, focus on making sure we make the transitions from red, orange, and yellow properly, making sure that the public is social distancing and doing all those things we've been taught. And I kind of look at it as not A, B, C, D. I look at it as A, B, C, D, E, F, G, H, I, J, trying to manage the entire event, because part of that is keeping the economy going. So we've got a great commission. It's well balanced. General Burton's on it. Dr. Good from the University of Utah, medical professional. Again, Derek, you're on it from the business community. And we've got legislators on it. And I think we're all trying to pull the same direction and trying to make this move forward in as efficient as way as we can. And it's great to be in Utah, because I really think we're leading the way with this. So anyway, thanks, Derek.
Thank you, President Adams. And I wanted to underscore something that you said about businesses and what they're doing to stay safe and stay open, and especially as it relates to PPE. I actually went and saw my dentist this morning. One would not normally say they look forward to visiting the dentist. But in this case, I actually did, because I was very eager to see how they were going to have their operations set up. And I have to say they did everything by my observation perfectly. They had me wait in the parking lot, tell them when I was there so they could have somebody come, so that they didn't get their waiting room too full. Went right in. They were all wearing their PPE. And, besides the fact that I had to go through some pain, it was a nice experience. So we are seeing a lot of businesses stepping up and doing the right things. And I want to use that as a segue to our general counsel at the Salt Lake Chamber, Jacey Skinner, who's been leading a working group as part of the task force made up of 80 to 90 industry associations who multiple times a week are getting together, and they're talking about what they're learning, what they're doing, how they can share best practices. And Jacey specifically will talk to us about what we're learning as we've moved from red to orange, and how that learning will inform moving from orange to yellow. So thanks, Jacey. Take it away.
Thank you, Derek. It's nice to be with you all today. As was mentioned, we're a little bit over a week into the orange phase of the health-related guidelines. These guidelines, we've got lots of different phases, and we talk about them in a lot of different ways. This is different from the urgent economic phase. These guidelines relate specifically to those external health conditions that exist, and they determine and affect the way that we operate, right? Those external risks help us inform how much care, how much caution our businesses need to operate with, and we as citizens need to operate with while we engage with businesses and our friends and family. I hope you all have a basic understanding of this, but I want to walk through a little bit different, a little bit of this in general. The recommendations, and I want to respond to some of the questions that have been in the chat there, the recommendations to move through these different phases of our health and economic guidelines come from the Utah Health and Economic Response Committee, which is what President Adams was just referring to. That committee operates separately from the economic task force that Derek runs, and also independently from the COVID-19 task force that the Lieutenant Governor runs. It's kind of a cross-section of all of those different areas, but is able to look at those specific external health guidelines, look at what's going on in our economy, and make recommendations to the governor as to how we should be moving through those different economic phases, or those health phases, excuse me. And then the governor takes that recommendation, and in consultation with the health department is able to move us back and forth. Our success of being able to continue to move forward really is dependent upon our success of implementing these guidelines. As we're diligent and successful moving forward, we'll get to continue to move forward. If we're not, and we have revisions and spikes in the virus that show that it's not safe for us to work at the level of care that we're currently operating under, that's when we're going to have to move backwards. And so our ability to move forward, I mean, I love that our economic plan here is it's Utah Leads Together. It requires everyone's cooperation in order for us to move forward, including our businesses. And as Derek mentioned, we've been working very closely with businesses across the state, not only to help develop these guidelines, working with Levitt Partners and the Department of Health, but the specifics of how we operate them. And we've learned a lot in the last week. We've learned a lot about how you can put out the best plans, and if your customers don't cooperate, that's an entirely different thing. We've also learned about the concerns of citizens and their consumer confidence as they go into businesses and see the levels in which they are diligently applying these guidelines. So I think those are just very important things to go through. I want to, hopefully I can share my screen. I want to walk through just a couple of things, just so you understand how this committee that President Adams referenced the factors that they're considering as they make these decisions as to how we move through these guidelines. And I just want to show this briefly here. Let's see, Derek, I can't see my screen.
I can see it.
And is it correct?
Well, you tell me. It looks
core
good.
measures. They've got core measures on the screen. Hopefully.
That's yes, core 4 measures.
Perfect. Thank you. I want to reference to the state has done an amazing job of populating the coronavirus.utah.gov website. Any question you have, your answers can be found there, including this document. This is in the Utah Leads Together plan that talks about how we move through these. I am not the health expert. I am not this committee, but these are just the 4 core measures that they're looking at. We've talked about it before on this call, but the proxy of the transmission rate, the governor talked about that transmission rate, hospital utilization, we've talked about that as well, our ability to monitor and detect, and our ability to determine exposure sources. As we work through those different guidelines, we get to move forward as we successfully do those. But those, just for the audience, those are the things that we are considering. I want to share one other thing with you as we talk through these guidelines for you all to see, and hopefully, again, I successfully do just that. Give me a moment as I go through this here. But as we move forward, want to make just a couple points about what these guidelines look like. One question that we often get is in reference to the uses of masks or face coverings, or are these guidelines requirements? Are they orders? And Governor, since I have you on the phone, if I'm wrong, or Kristen, if I'm wrong here, we may ask you to chime in. But as we work with the health department and talk with the various agencies, the important thing to remember here is these are guidelines. However, the governor has issued an order, and the order states that these guidelines are adopted as an order in respect to individuals acting as an employee of a business and for an individual in a healthcare setting. And then they are a strong recommendation to individuals not identified in 5, and that talks about specifically individuals wearing masks. So I bring this up because my phone is constantly ringing with concerns regarding employees not wearing masks or not following the guidelines. And I just want to point out that in respect to businesses and employees, that is in fact a requirement. To your customers who you are relying on them to wear them, that however is a strong recommendation to the public that they do so. I just want to mention that, you know, I am getting these complaints, your local health departments are getting complaints, businesses are getting complaints from consumers who go to businesses who aren't complying, they don't feel safe, and they don't stay. So I want to point out here that your success is determined by the confidence that you can instill in your customers. And that's a very important point of moving forward. Implementing these guidelines requires some creativity, and it certainly requires a lot of diligence. If your business is not specifically listed in the guidelines, then you should follow the general guidance and adopt the best practices from similar industries. If you are struggling to know what to do or how to do that, please reach out to the chamber. You can reach out to me personally, and we can get you in touch with someone who can answer your questions, or we can try to answer your questions as well. Your various industry associations and different groups have come up with really great ways to help you adopt and adapt to these guidelines, which you've probably seen as you've ventured out to businesses throughout the week. The other thing that I want to note is that these guidelines are constantly being refined based on feedback and recommendations. So if you have suggestions, make them known. As President Adams mentioned, this particular committee that he's working with is taking those recommendations. They're making those recommendations to the health department, to the governor, and we've seen those guidelines refined over and over and over again. We're currently on version 4.1. We bring this up is our point is to get this right and to make them work for the public. So we encourage you to reach that out. And finally, I just want to recognize that we are we're also working with the state to create a process for you to officially and formally demonstrate your compliance with these guidelines. Whether it's in the orange phase, as we move into yellow, we want businesses to be able to demonstrate to their customers that they are officially working with that. We're in the process of developing that right now, and hopefully we should be able to bring an update to you on this shortly. But I want to end just by noting, I'm really glad that Utah is doing well. We're glad that our businesses are being able to adopt this. Doing well means that we're saving lives, and doing well by saving lives means that our economy gets to recover more quickly. So thank you to all of you who we've heard from today for all of the work that you're doing. Thank you to the businesses that are so diligently applying these guidelines. And thank you to all of you as consumers who are also doing your part. Thanks, Derek.
Thank you, Jacey. And I'm really excited to get to our last presenter to talk about some innovative things and plans that are happening on the travel and tourism side. But before I do, Jacey, I do want to ask one question, and I think you're the right one to ask because you've been working with all these industry groups. And I know specifically sort of a new group has formed that's looking at events. And can you share with us the current thinking on what events look like going forward, not necessarily in next week, because we know that's not possible, but as we start to look towards the summer or even the fall, how do you see things shaping up based on those experts and their discussions?
Thank you. This is a tough area, and I think many of you, I don't think we all recognize this. We've spent a lot of time talking about some of those industries that we immediately see, right? Restaurants, Main Street businesses. We saw very visibly the effect on those businesses. One of the areas that's been a little bit more hidden from view has been these event areas. As you think about it, conferences, business meetings, those kinds of things were the very first thing that were canceled. They were the very first thing that went away as we first just started to hear about the effects that this virus could have. Those type of events started to cancel, and those are the things that will be one of the last to come away. And so this is an area of our economy and an industry that has been hit as hard, if not harder, than anyone else, and it's the hardest for them to recover. This is a group that has very diligently been meeting and working closely with the local health department and with the state health department to demonstrate how they can in fact hold events under these guidelines. It requires, as we've mentioned, a lot of creativity. What we know is that events are not going to look like what we've known for a while. It doesn't mean that they can't occur. And but how we hold them is going to need to look a little bit different. But that is one of the biggest things that I think that our economy, that our population is craving. As we've been in a social isolation type of a phase, we want to be able to get together. We want to be able to support our arts. We want to have community festivals. We want to be able to gather in places. Again, our ability to do that is going to depend upon our guidance, our compliance with these guidelines. But I want you to know that your cities, your municipal event planners, the people who plan other kinds of weddings and other events and who support our plays and our symphonies and our ballets and our museums and everyone else, they are working very hard to come up with ways that the health department and the health commission and the governor can feel comfortable with, that we can both engage in a socially distanced, safe way and help comply by those guidelines. So it's one that we invite everyone to help support. Again, this is an industry that has been incredibly hard hit and needs to benefit from everyone's support and creativity.
Thanks, Jacey. Let's use that as a segue to talk about another industry that's been very hard hit, and that's our tourism industry. And we're grateful that Vicki Varela, the executive director for the state's Office of Tourism, has joined us to talk about what's happening in tourism and what that looks like going forward. So thank you, Vicki.
Thanks much, Derek. And thanks to all of you for the leadership that you're showing, which enables us to try to think about how we can put together put this complicated problem back together and save as many members of our industry as practical. Governor, thank you so much for your leadership. The steadiness, the pro-mask is pro-business message coming from you. I've gotten several comments today on how much your leadership has been appreciated through this. So I'm just going to fly through. I know we're toward the end of the meeting, but I'm just going to fly through a little overview of what's happening on the marketing side as well as the industry relations side of the tourism recovery. And my computer just melted down this afternoon. So my colleague is helping me, and we're going to the first slide, tourism goal. Our goal is to come out of this, let's go to the next one, more mighty than ever. And you see the word mighty. We rolled it out in 2013 with the Mighty 5, and you'll see iterations of mighty throughout our all of the things that we're doing today. We know that being more mighty than ever is a marathon, not a sprint. Our businesses are looking to well into 2020 before they start to see recovery. For the first time in Tourism Marketing Performance Fund history, our target markets are regional car travel and UTOMs. We know from everything we've experienced so far with people getting back to state park visitation and itching on national park visitation, we know that UTOMs want to get out and celebrate our spectacular outdoor vistas. We are monitoring consumer sentiment region by region. It's far too early for us to be trying to get people to travel. There is enormous reticence. We won't see a lot of flights, even domestically, for a very long time. International travel is pretty much out of the equation until sometime well into next year. And so we have 3 phases of market reentry. We're currently in what we call inspiration, reminding people of everything that we have to offer and how much they love it, so that when they do start to think about travel, they will think about Utah. Our second phase is renaissance, starting to give those calls to action to travel, and then normalcy, which we see as several months out. So Becky, if you could go to the next one. Our small but mighty campaign, I will show you in just a moment, but I hope you will get the same feeling that I do from it, that we need to be really careful stewards of our own public safety, of others' public safety, and that can carry forward into great stewardship of our public lands. Eventually, we will do a Mighty 5, not your grandma's Mighty 5, not your 2013 Mighty 5, but a 2020 style Mighty 5 that will call people, the call to action will be about regional travel. And integrated into all of this will be this Forever Mighty stewardship message, which you'll see rolled out over the next couple of months. And so Small But Mighty is playing now on connected TV in surrounding states. Having a little video issue.
A little rain over time, freezing and thawing. That's all it took to create the thousands of arches in Utah. So if you feel insignificant, simply staying at home, don't. You're doing your part. You're making a difference, just like a little bit of rain. By being careful, you protect those around you. It's a small thing, but it's mighty.
We're going to skip the next ad in the interest of time. And I'll tell you that we've done an industry study that has shown people are hurting. The study was done by Entrada Insights. It's a local firm with an international business to do tourism research. 72% of our businesses are projecting revenue declines of 55% plus through the end of the year. About 50% have funding for 60 days or less. We'll go to the next one. 46% of them have received federal or state assistance. 33% applied for EIDL, but only 4% were funded. And that's the real pain point that I know Jacey and others we've got to do something to break through the problems with EIDL. The highest marks are for the GoEd program. Utah Leads Together Bridge Loan Funds. 19% applied and 14% were funded. Of course, the dollar amounts were much lower on those. The greatest needs that we're seeing are for additional grants and low interest loans. And we know this is hard because there's not enough money for all the needs out there, but a tremendous cry for help from those businesses who can't last more than 60 days. They also need application assistance. Lots of struggles, particularly with the federal programs. Marketing support, because we don't have TRT in most of our counties, because nobody is staying there. They're especially dependent on the Tourism Marketing Performance Fund to get out their marketing story. And then to the point that Jacey made on events, there's a desperation for clarity around best practices in this next phase. And I've communicated with Natalie, and I think that will be a robust part of the next phase of our marketing. we have lots to be optimistic about. People crave what we have here in Utah. And at the right time, we will welcome them here to experience it. There is some work being generated around best practices initiatives, as Jacey referenced. And then I just want to highlight great conversations that are being led by the Speaker of the House around maybe this is a time that we can actually invest in some things that will make this state better. Once we get through the COVID drama, he's got really interesting ideas about investing in outdoor recreation. I know our time is short. Thank you very much for all your leadership and your assistance to help us get this industry back in shape.
Well, thank you, Vicki. I had the same reaction in watching this presentation now a second time, and it's a happy, sad reaction. I'm sad to see what's happened to so many of our great companies and how they've been impacted, and not just companies, but individuals, but happy to see and be reminded of what a beautiful state we live in. So thank you for that. It's a state worth saving, and that's because it's people worth saving. Thanks to all our presenters today. Thanks to participants who've joined us. Please remember, we've got a Utah Leads Together webinar presented by the Salt Lake Chamber tomorrow at 2 p.m. The subject is communicating confidence to your team, customers, and partners. For more information, you can visit the Salt Lake Chamber's website. And as always, we'll look forward to being with you next Tuesday on the Task Force Town Hall. Thanks, everyone.
Thank you.